Hello, my name is Jody Klier-Butler. I am the Nursing Assistant and Medication Aid Program Director with Avalon Healthcare of Oregon. Today we will be reviewing the mental health disorder of depression and treatment with antidepressants. Some key abbreviations you should be familiar with are CNS, Central Nervous System, MAOI or monoamine oxidase inhibitor, SSRI, selective serotonin reuptake inhibitor, TCA, tricyclic antidepressant, OCD, obsessive compulsive disorder, PTSD, post-traumatic stress disorder. Depression is one of the most common mental health conditions. Treatment includes medications that will affect the mood. According to the World Health Organization, depression affects more than 300 million people worldwide. It is the leading cause of disability globally, and it knows no age limits, tends to affect women more than men, and can lead to suicide. The World Health Organization reports that fewer than 50% of people receive treatment. According to the World Health Organization, the number of people affected by depression rose by 18% in just 10 years, from 2005 to 2015. The National Institute of Mental Health reports that approximately 16.1 million people ages 18 or older had at least one major depressive episode in the previous year of 2015. This represents 6.7% of the U.S. adults. Adolescents are affected too. The National Institute of Mental Health estimated in 2015 that 3 million U.S. adolescents ages 12 to 17 had at least one major depressive episode in the past year. This is 12.5% of children in this age group. Major depressive disorder. This is a chronic, reoccurring form of depression and is the most common mood disorder among Americans. The American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders classifies depression as a mood disorder that causes disturbances with how a person feels, thinks, acts, and behaves. For a diagnosis of depression, symptoms must be present for at least 2 consecutive weeks. There are many signs and symptoms of depression. To name just a few, depression includes feelings of sadness or depressed mood, feelings of hopelessness, feelings of guilt, worthlessness, or helplessness. There can be changes in appetite, which can include weight loss or weight gain that is unrelated to any type of dieting. There could be a loss of interest or pleasure in activities that once were enjoyed. The patient could have problems sleeping, or they may be sleeping too much. There may be purposeless physical activities such as hand-wringing or pacing or slowed movement and speech that is noticeable by others. There could be difficulty thinking or concentrating or making decisions. There could also be thoughts of death or suicide. This is not an exhaustive list of signs and symptoms. In addition to the previously mentioned signs and symptoms of depression, older adults can often exhibit additional signs and symptoms, such as anxiety, a slow or unreliable memory. They could be showing increased dependency or paranoia or agitation. They could be focusing on the past. They could have increased difficulty in completing their ADLs. They could have new changes in their sleep patterns, withdrawal from people and their interests. They could also show muscle aches, abdominal pain, headaches, nausea, vomiting, dry mouth. So I encourage you to know your patients. Pay attention to these changes, no matter how small or how large. There are several factors that can put a person at risk for depression. Genetic, personal, environmental, and biochemical are all risk factors alone or in combination. There's a lot that is still unknown regarding the genetic link. They do understand that there is a familial link to depression. For example, some genes shared by family members are responsible for the production and transport of certain neurotransmitters that affect the mood. Environmental or non-genetic factors that can contribute to depression can include things like poor and stressful relationships with others, social isolation, loss of employment, in addition to some medical conditions such as strokes, myocardial infarction, cancer, or Parkinson's disease are a few examples. There are even hormonal factors in women that can contribute to depression, such as the menstrual cycle, pregnancy, miscarriage, and before and during menopause. In addition, there are also some medications and recreational drugs that can cause depression. Before a patient can regain full function, they normally go through 3 phases of depression. The first phase is the acute phase. This is the time from the diagnosis of depression to the first treatment response. This can take up to 6 to 8 weeks, but often can take longer if the person does not take the medications as prescribed or does not attend any other therapies. Unfortunately, some patients will stop treatment. The second phase is the continuation phase, and this really is working to prevent a relapse and obtain a full recovery. The patient should be symptom-free for at least 6 months. And the final stage is the maintenance phase. The goal here is to prevent the disorder from reoccurring. The monoamine hypothesis of depression believes that depression can be a result of an imbalance of neurotransmitters. A neurotransmitter is a chemical that allows the cells to communicate with each other. A neurotransmitter passes from one cell to the next cell via a synapse, and they can either increase or decrease the activity of the receiving cell. This theory proposes that depression is caused by a decrease of norepinephrine, serotonin, and/or dopamine, which are monoamine neurotransmitters in the brain. A decrease in these neurotransmitters are believed to play a major role in the development of depression. Both antipsychotics and other mood medications were introduced into use in the 1950s. The earliest discovery of medications that improved symptoms of depression by giving patients an improved mood and sense of well-being occurred when clinicians used mycobacterial agents such as isoniazid and iproniazid used to battle tuberculosis. These agents work by inhibiting the monoamine oxidase enzyme. This is what led the clinicians to realize that depression had a neurochemical connection and cause, and would potentially be able to be managed by using medications that improved and corrected the underlying imbalances of the neurotransmitters. The first class of antidepressants that were used were monoamine oxidase inhibitors, or MAOIs, and the second class used were tricyclic antidepressants, or TCAs. The most recently developed antidepressants are selective serotonin reuptake inhibitors, or SSRIs, serotonin norepinephrine reuptake inhibitors, or SNRIs. There also are more reuptake inhibitory antidepressants that include norepinephrine dopamine reuptake inhibitors, or NDRIs, and serotonin 2 antagonist reuptake inhibitors, or SARIs. These inhibit the given neurotransmitter from being taken back into the presynaptic neuron. This allows more of the neurotransmitter to remain and bind with the receptors, therefore improving the therapeutic effect and patient's mood. MAOIs. This class of drugs inhibits the release of the enzyme monoamine oxidase. When this enzyme is not released, it is not present to break down the neurotransmitters serotonin and norepinephrine. By these transmitters not being broken down, it allows more to be available to the nervous system and therefore improves the mood. Drug effects are usually seen within 2 to 4 weeks. MAOIs are not used very often nowadays, and they have many potentially fatal food and drug interactions, including one with over-the-counter cold and cough medications that can lead to a major hypertensive interaction. This can occur when a patient who is taking an MAOI eats tyramine-rich foods such as aged cheese, meats, wine, beans, or canned or frozen soups. Signs and symptoms of a hypertensive crisis include excessive sweating, tachycardia, chest pain, and sudden and explosive headache. This is a medical emergency. It is important to know your dosing. It's also important to remember to look up your medications if you have any doubts. I have 3 examples of MAOIs: Marplan, Nardil, and Parnate. The initial dose for Marplan is 10 milligrams twice daily, with a maintenance dose being 40 milligrams, and the maximum daily dose being 60 milligrams. The initial adult dose for Nardil is 15 milligrams 3 times a day, with a daily maintenance dose being between 15 and 60 milligrams, and a maximum daily dose of 90 milligrams. Parnate, the initial adult dose is 10 milligrams twice daily, with a maintenance dose being 30 milligrams and a maximum daily dose being 60 milligrams. When you give MAOIs to your patients, you are assisting the nurse with the nursing process. Assess the pulse rate. Take the blood pressure in both the supine and standing positions. Measure the blood glucose. Ask your patient about the foods and fluids that they have consumed during the past few days. Make sure you know your initial adult dose, daily maintenance dose, and the maximum daily doses. Implement the order. Usually MAOIs are given to patients 2 to 3 times per day, but the last dose should not be given any later than 6 p.m. so it does not cause insomnia. Evaluate the effects of the medication. Orthostatic hypotension is the most common side effect. When the patient is first started on the drug, dizziness and weakness may occur and should be assessed for by taking the blood pressure daily in the supine and standing positions. You should also remind your patient to stand slowly from the sitting or laying positions, and if they feel faint, remind them to immediately sit down. Drowsiness or sedation side effects usually disappear with dosage adjustments and continuous use. Restlessness, agitation, insomnia, these usually resolve when the medication is given before 6 p.m. Blurred vision, constipation, urinary retention, and dryness of the mouth, nose, and throat are also side effects of these medications. Follow your care plan for constipation and urinary retention. If the patient has blurred vision, take safety precautions. And for dry mucous membranes, allow the patient to suck on hard candy or ice chips or chew gum as long as there is no choking risk. And finally, hypertension is a risk with these drugs. It is important to remember that there are many drugs, foods, and fluids that potentially can contribute to this when a patient is on MAOIs. Tricyclic antidepressants, or TCAs, were developed as antihistamines, but were unsuccessful in managing allergy symptoms, but improved the mood of these depressed patients. TCAs block the reuptake of two neurotransmitters, norepinephrine and serotonin. This enables there to be more of the neurotransmitters to be available at the receptor sites and therefore has a positive effect on the mood. There are some negative side effects on cardiac health and also can cause death if taken in higher doses. Patients should be evaluated before starting on a TCA for suicidal potential. There are some off-label uses for TCAs, such as managing pain that is related to fibromyalgia or diabetic neuropathy. Again, it is important to know your dosing. Let's review a handful of TCAs and their dosing. Elavil. The initial dose is 25 milligrams TID, with a daily maintenance dose between 150 and 250 milligrams and a maximum daily dose of 300 milligrams. Anafranil, 25 milligrams TID, daily maintenance dose between 100 and 150 milligrams with a maximum daily dose of 250 milligrams. Norepinephrine, 25 milligrams TID with a daily dose between 75 and 200 milligrams with a maximum daily dose of 300 milligrams. Tofranil, 30 to 75 milligrams daily at bedtime with a daily maintenance dose of 150 to 250 milligrams and a maximum daily dose of 300 milligrams. And finally, Aventil, 25 milligrams, 3 to 4 times daily, with a daily maintenance dose of 50 to 75 milligrams and a maximum daily dose of 100 milligrams. General side effects for these drugs include cardiac arrhythmias and QT interval prolongation. Anticholinergic effects, which are dry mouth with related dental problems, blurred vision, tendency toward overheating, and in some cases, dementia-like symptoms. Also orthostatic hypotension, sedation, elevated intraocular pressure, and extrapyramidal effects, which are drug-induced movement disorders that include acute and tardive symptoms. Also, these drugs can cause weight gain. The patient should be assessed before starting on a TCA for their cardiac status, and this should include completing a pre-treatment ECG. You will assist the nurse with the nursing process by assessing their bowel condition. Ask the patient when they had their last BM. Remember, constipation is a side effect. Be sure that you follow their care plan for bowel and urinary retention. Take the blood pressure daily in the supine and sitting positions, as orthostatic hypotension is also a side effect. And take the pulse rate and rhythm. You must report any tachycardia or irregular pulse to the nurse immediately. Make your plan and know your initial adult dose, daily maintenance, and maximum daily doses. Also, remember that dose increases should take place in the evening because they will increase the side effect of sedation. After giving the medication, evaluate your patient for side effects such as blurred vision, constipation, urinary retention, dryness of the mouth, nose, and throat. Sedative effects can occur, so make sure you take all precautions to prevent falls or accidents. Tremors, numbness, tingling, seizures, and Parkinson's-like symptoms are also side effects, and you should take the necessary precautions to keep your patient safe. As mentioned earlier, the patient should have a pre-treatment ECG and cardiac status should be monitored. These drugs can also cause the patient to have suicidal ideations, and therefore we should observe for any signs and take the necessary safety steps. Selective serotonin reuptake inhibitors, or SSRIs, inhibit the reuptake of the neurotransmitter serotonin. These are the most commonly and widely used medications for managing depression in today's world. They are thought of as the first-line treatment. For patients that experience side effects while taking an SSRI, it is recommended that they may benefit from taking another drug in the same class. SSRIs are by far safer than MAOIs or TCAs. They have much fewer side effects and have a much less chance of death due to overdose. Assist the nurse with the nursing process by measuring the blood pressure in both the supine and standing positions. Weigh the patient weekly, observe for insomnia, nervousness, and other central nervous system signs and symptoms. Check in with your patient regarding any GI symptoms. Know your doses. For example, Celexa, the initial adult dose, is 20 milligrams daily, with a daily maintenance dose between 20 and 40 milligrams and a maximum daily dose of 60 milligrams. Zoloft, the initial adult dose depends on comorbidities and is between 25 and 50 milligrams daily. The daily maintenance dose is quite broad at 50 to 200 milligrams. Lexapro, the initial adult dose is 10 milligrams daily for an adult. The daily maintenance dose is between 10 and 20 milligrams. And Prozac, the initial adult dose is 10 to 20 milligrams daily, depending on comorbidities. And the daily maintenance is 20 milligrams daily with a daily dose not to exceed 80 milligrams. Report and document any of the following symptoms: restless, agitation, anxiety, insomnia, sedative effects, GI effects, or suicidal ideations. These usually will occur in the early stages of the therapy. SSRIs are also used to treat other disorders such as PTSD, anxiety disorders, or obsessive-compulsive disorders. Other antidepressants. We have SNRIs, or serotonin norepinephrine reuptake inhibitors, NDRIs, norepinephrine dopamine reuptake inhibitors, SARIs, serotonin 2 antagonist reuptake inhibitors. These inhibit the reuptake of serotonin and norepinephrine and dopamine, and serotonin. SARIs, in addition, inhibit serotonin 2A receptors. SNRIs are serotonin norepinephrine reuptake inhibitors. Examples of these include Cymbalta, Pristiq, Effexor. Adverse effects of SNRIs include depression of the central nervous system, nausea, headache, decreased appetite, hypertension, insomnia, and serotonin syndrome. Serotonin syndrome is a group of symptoms that may occur following use of certain serotonergic medications or drugs. Symptoms include high body temperature, agitation, increased reflexes, tremor, sweating, dilated pupils, and diarrhea. Use with caution in patients that have seizure disorders, hypertension, and liver or kidney problems. And remember to taper medications to avoid discontinuation syndrome. Typical symptoms of discontinuation syndrome include flu-like symptoms, insomnia, nausea, imbalance, and sensory disturbances. NDRIs, or norepinephrine dopamine reuptake inhibitors. An example of this is Wellbutrin. Adverse effects include anorexia, lowered seizure threshold, nausea, blurred vision, central nervous system stimulation, and hypertension. These drugs are contraindicated in patients with a history of seizure disorders, anorexia nervosa, or alcoholism, Use caution when using with patients that have renal, hepatic, or cardiovascular problems. NDRIs can be fatal when combined with MAOIs. SARIs, or serotonin 2 antagonist reuptake inhibitors. Two examples of these include nifazodone and trazodone. Adverse effects include anticholinergic effects, hepatotoxicity, headache, agitation, priapism, and sedation. Precautions. It should be noted that SARIs should not be taken by patients who are taking MAOIs. Use with caution in patients with seizure disorders. It is important to remember that there are other uses for some antidepressants, and those are to treat people who have other mental health disorders or physical conditions. A few examples include panic disorders, OCD, PTSD, attention deficit hyperactivity disorder, bulimia, and physical pain. Wellbutrin also has been used for smoking cessation. Also keep in mind that antidepressants don't work for everyone, even if they take as prescribed for the appropriate duration. Sometimes monotherapy does not work for a patient, and therefore the doctor will add a medication from a different class. It is quite common for antidepressants to take 2 to 6 weeks for the patient to see any therapeutic effects, and sometimes it can even take longer. Remember to talk with your patients and encourage them to explore other ways to improve their feelings of well-being. What could this be in our facilities? If appropriate with their care plan, encourage your patients to join group activities, go on outings, dine with other residents, go for walks. There are also concerns for patients with depression with the risk of suicide. These patients should be assessed by their healthcare provider before starting antidepressants and should have continuous monitoring for signs such as changes in mood and being preoccupied with death or giving away their belongings. Keep a close eye on your patients on a daily basis. Antidepressants can be effective for many of your patients, but they do not work for everyone and they do not work quickly. Be supportive to your patients as they work with their medical provider to find the best treatment for their individual situation. Now that you have completed viewing this PowerPoint, please contact the instructor to set up a time to complete your associated assignments. Thank you and good luck.